Welcome to the Soulful Surgeon Podcast with Dr. Lisa Hunsicker, a sanctuary for healthcare workers. In this space, we honor your stories, your struggles, and your triumphs. Here, you are more than your role. You are seen, heard, and celebrated. Join me as we explore conversations that nourish the heart, elevate the mind, and remind us why we chose the path of healing. This is your time. This is your place. This is the Soulful Surgeon Podcast. Hi, everyone, and welcome to the Soulful Surgeon Podcast. I'm your host, Dr. Lisa Hunsicker. This is the place where healthcare workers come to be seen and heard. And really, this is a thing that I have wanted to cultivate for quite some time, this podcast, to talk about some of the great things in healthcare, some of the funny things in healthcare. But many times it's a lot of the things that are occurring that most people don't know. And this is something that we healthcare workers share, and we have incredible knowledge, but we're also tied into our jobs that we're not really communicating this. And today I want to talk about healthcare cost transparency. And this is something I think that is contributing to the incredible cost of what healthcare charges patients, charges vendors. There's so many things. And certainly, just what our parents and our grandparents have been saying, so much more expensive now. And everything is getting more expensive. And certainly since COVID has come and gone, our staffing are more expensive, but also all of our equipment, everything that we do as a healthcare business, that we use our services, our products, everything has become more expensive. Now, the interesting thing, when you think about business, there's a couple of things. You have to basically talk about your revenue. That's how much money you bring in. And then your expenses, that's how much money you spend. And then your profit, whether it's positive or negative, either you're making money or you're losing money. And certainly, and as anyone in business knows, we have a profit and loss sheet, and we look at that and we analyze it. And I think if you would talk to most business people, when they look at businesses and decide whether or not this is a viable business or this is a good idea for a business, I think most experienced business people would look at a medical practice as a terrible business idea. And not from the standpoint of the care that's being delivered, but as simple math, that the money in and the money out, they just don't balance enough to keep cash flow running. And that's a simple equation, but we don't really talk about in medicine because we're so wrapped up in talking about all of the healthcare workers' moral obligation to treat people. And I don't know of any other job where that's the case. And when you go to the grocery store and you walk in and you're very hungry and you need to eat and you don't have money, that really doesn't change things. You can't go in and empty a shelf of food and walk out and not pay for it. If you have a plumbing issue and you call the plumber, we all know you have to pay the plumber to come out to assess, and then you have to pay the plumber in advance to fix whatever it is. And so this is just sort of how business has been done. And this is the way our economy has worked for many, many years. But then there's healthcare. And one of the things that has occurred is that all of the cost of healthcare and all of the expense of healthcare has been very private. And we don't want to talk about money. And that's what's actually crippling us, is that we're not talking about money. And the patients think that we are rude and we're short and we're curt and that we just want to get in and out of the rooms. But really what it is that our patients can't come back to see us and have another visit if our doors are closed because we can't pay our rent or we can't pay our staff. And so one of the things that patients have are called EOBs, and that's an explanation of benefits. And so typically what happens is, say one of my patients goes to have a surgery. They get costs from the operating room and the hospital. They get costs from myself and my practice. They get expenses associated with anesthesia, and they get expenses associated with pathology. So all these things are all in play. But basically what ends up happening is they get a report of what was billed to the insurance company, and then what the insurance company paid, and then what there is being allowed and what is not being allowed, and also what the patient's responsibility is or is not. And so one of the things I would love to see is hospitals turning over the costs and making it very transparent. Because we're billing, and what the public doesn't understand is that we are billing, and everyone is so exasperated about how expensive those billing numbers are. But then when you look at what you bill and what you receive a minuscule amount compared to what you bill. And it's always this game. And it's like you never have the pieces of the puzzle, and it's a guessing game. And I can do 100 patients with the same insurance and bill the exact same fee. And every single time it comes back different for the exact same thing. And it doesn't come back for months. Whereas, when you go to a restaurant, you pay for your food and you get your food and then you eat, and the person got their food and the restaurant got their money, and it just goes on and on. But with us, we just get to keep showing up. The hospitals get to still being there and have their doors open and be mandated to not turn anyone away by a risk of being in out-of-state compliance because they rejected someone because they couldn't pay. And the problem is someone has to pay for that. And the state's not paying for that. What ends up happening is the other patients are having to pay for that, but still, it's not even being covered. And what I would love to see is for hospitals, when they have their EOB, also have a list of the exact cost of what this is. Because I think what we're going to see, because I see this in my own practice, we're still coming up negative. And so the hospital is supplying all the equipment, the facility, the staff, all of the products, all of the care. And the problem is that the insurance company isn't going to pay. Or it's going to pay when it feels like it. It's going to pay when it wants. And so, here's the thing. If I sell donuts and it's $6 and it costs me $5 to make a donut and I'm selling it for $6, you're going to come in, and if you want the donut, you're going to get that. But the problem is that we have another third party called insurance companies. And this gets in the way, and they show up, and I don't know. I don't even know if we're going to pay. I don't think we're going to pay. I know you say that you need this, but I say you don't. And I know you're trained to make that decision, and I'm not trained to make that decision, but I'm not really going to cover you, and I'm not going to pay. And now you've paid $5 to make that donut, and so you're out your $5, but whatever. Or say, you know what, I'm going to pay you a nickel. And I know you said it's $6, but I'm going to pay you a nickel or a quarter or $1. And it's all different every single time. So from a business standpoint, this is a terrible idea because there's no predictability. And what ends up happening is and we see this in primary care, that this is the best example where we have to see patients, every 8 minutes. And the patients need to talk to their doctors. The doctors or the nurse practitioners, the PAs, or the nurses, whoever's taking care of the patient. We need time with the patient to be able to gather information, except that once your 7 or 8 minutes is up, I have to be on to the next one because I can't make my rent. And I think this is something that patients need to know about. And I think they need to do something about this. And I think we need to talk about how to come up with a non-insurance based plan for care so that we all don't go bankrupt. And that's essentially what's happening. And when we look at burnout, the hospital systems are burnt out because they're trying to constantly move money here and there to cover because they're not being reimbursed properly by insurance companies and by patients, because there are some people who don't carry insurance and they come in and they have care and then they don't pay for their care. And ultimately, someone has to pay for that. And that's going to be all the patients who do have insurance or who are paying cash, but also it's the hospital system as well, because they've already bought it and now they've used it and they haven't recovered fees to be able to pay for it and keep it going forward. So I think this is something that is going to be a really difficult conversation, but this is really the heart of our healthcare problem. And on top of that, you have to cover malpractice, right? Because we've got to have, tens and hundreds of thousands of dollars that are being done in excess testing to cover for malpractice, which is more expense, which yields essentially not necessarily any useful data, but it's based on you have to pay to go to work and legally protect yourself. So this is just another facet of all of the financial woes of medicine. And what I would really love to see is for everyone to sit down and say, look, this is the cost of seeing this patient. This is the cost of doing this procedure on this patient. This is the cost of these remedies for the patient. And this is what insurance is or is not paying. And I think one of the things we have to do is we really have to disclose this so the public can see what is happening. But we also really need to get the public involved in this because they're the client. They're the client for both of us. They're the client for the hospital and healthcare providers in private practice, but they're also the client for the insurance companies. And they really have been separated, and really the patient has the relationship with the insurance company. And we have inserted ourselves into that conversation, and now we're being choked out. We can't make decisions our own. All of these healthcare companies are making decisions for us. When I have a patient who's going to surgery and I put down what needs to be done, and the insurance company says, no, we're not going to cover that. And they're making the decision financially for the patient. Now, the patient has the onus on themselves to do what's the right thing for them. And I think we have to have those conversations with our patients and say, look, this is what they're saying, but this is what you really need. And this is what the cost is in order to achieve that. But your health and your well-being is the primary concern here, and you have to be involved in that. And we have to get the public involved so that they can be their own advocate. But the question is they're also the client with the insurance company. And if the insurance company is not taking care of their own clients, then maybe we need to come up with a different system and begin to phase out insurance companies altogether, or get people into the insurance companies to make this work. But right now, we're collapsing as a healthcare community. And what's going to end up being left is a bunch of insurance companies who have a lot of money because a lot of people have paid into it. But there's no healthcare places to go. There's no healthcare workers to see patients because it's all gone bankrupt. So this is something I want you to think about. If you have suggestions, please put it in the comments, because I feel like this is a conversation that we have to start talking about. And this isn't about money hungry anything. It's simple math that is not working. So if you have a suggestion, put that down. If you want to talk about this, or you have a system that's working well for you, please, I invite you, contact me and let's do a podcast about it, but also put it in the comments so everyone else can really take this into their own healthcare situation and implement it so that things can get better. Thanks so much for listening today. If you have any questions or concerns, I'll obviously put it in the comments, or feel free to reach out. You can reach us at soulfulsurgeon.com.
and I'll see you next time.
Thank you for joining me on the Soulful Surgeon Podcast. I hope today's conversation offered you reflection, encouragement, and a reminder that you are not alone on this journey. If this episode spoke to your heart, please share it with someone who might need it as well. And don't forget to subscribe so you never miss a moment of connecting with healthcare workers all over. You can find us on the web at soulfulsurgeon.com. You can find us on Instagram at Soulful Surgeon. And you can find us on LinkedIn at Lisa Hunsicker, MD. Until next time, take care of yourself the way you care for others. And remember, your story matters here.